Chief Medical Officer Dr. Shamdeo Prasad, during a recent virtual conference, indicated that persons who were diagnosed with the COVID-19 without exhibiting any symptoms account for 65.3% of all the country's confirmed cases to date.
Overwhelmingly, the largest number of persons were asymptomatic, and from the figures we have, about 65.3% of all the cases were asymptomatic. Mild presentations, these are persons with intermittent mild fever, a dry cough, maybe a dry throat. Some people alluded to general malaise, about 9.3%. The moderate cases are the ones that we really look at more carefully, and about 29.3% of all of the positives had moderate symptoms as we classify them. Those who required ICU care, about 17%, and this was information provided by Georgetown Hospital. Those that really required critical respiratory support, about 14.6%.
A breakdown of the factors contributing to local transmission of COVID-19 shows that 74% of the patients who tested positive contracted the disease after coming into contact with a confirmed case.
We confirmed that about 74% of them did record some evidence of coming in contact with someone with this disease. Underlying conditions, about 34% of all the persons who were tested positive indicated that they have one of these conditions, inclusive of hypertension, diabetes, a heart condition, and some also have some lung condition. I also looked at some of the risk factors that have been talked about relating to COVID-19. We noted that about 26% of our cases were smokers, and they also were obesity in that group.
On Monday, Public Health Minister Valda Lawrence announced that an additional 5 persons were medically cleared of COVID-19. Since the outbreak almost 2 months ago, Guyana has recorded 27 recoveries with 9 deaths. The local COVID-19 case tally, Lawrence highlighted, has increased.
We are reporting 10 new cases, bringing the total number of confirmed cases to 92. 639 persons have been tested, of whom 547 are negative. There are 3 persons in our COVID-19 ICU, 7 in our institutional quarantine, and 56 in isolation.
7 of 9 deaths occurred in the COVID-19 intensive care unit, where 25 patients were treated. Tamika Rodney reporting for the HGB Nightly News.